Scott, welcome to episode 22, where we get the chance to explore a topic that I'm sort of like it's a home game for me, right? This is a big part of my 40-year career, and that is healthcare and patient advocacy.
Yeah, glad for that. Hi, Mark. Yeah, it's such an important topic. You know, we've covered a lot of the complexities and challenges related to access and affordability, but we haven't really dedicated enough time to the folks who are behind the scenes doing the hard work and helping patients navigate that complex system.
Well, we're fortunate. We had a chance to interview Melissa Page,
Right.
who was the co-CEO of the Healthcare Advocate Summit. And as you know, the podcast has been selected as a proud media partner. And so for us, the Healthcare Advocate Summit is in their words, the premier event for anyone involved in patient access, navigation, reimbursement, and advocacy.
Yeah, I think that's great. As you know, I'd certainly echo from my time practicing medicine earlier in my career, and then throughout my time in the life sciences industry as well. A big contributor to the success of our practice and our patients has been the patient advocacy organizations and individuals. And so I think it's about time that we spotlight these amazing people and learn more about healthcare and patient advocacy from them.
Great. Well, we have three great guests today. First is Rachel Westlake, who's the managing director of the Coalition of Healthcare Advocacy Organizations. We have Danielle Marshall, who's the executive director of the Patient Advocate Certification Board, and Fred Larrabee, who's the chief operations officer with HealthWell Foundation. Rachel, Danielle, Fred, welcome to the podcast.
Thanks. Happy to be here.
Thank you.
Okay, let's we're going to kick off. We Scott and I normally will introduce our guests, and but we'd like each of you to go through and sort of explain a little bit about your organization and its role in the broader advocacy community. So, Rachel, why don't we have you kick us off?
Well, as you mentioned, Mark, I am the managing director of the Coalition of Healthcare Advocacy Organizations. And the role and mission of the Coalition of Healthcare Advocacy Organizations, which we fondly call CHACAO, and I might say through this podcast because it's shorter, is to advance the profession of patient and healthcare advocacy. We support various roles of patient and healthcare advocates, and our primary focus of our member organizations is mostly on independent professionals, but we collaborate with all different types of other healthcare advocates and patient advocacy professionals and patients themselves for the benefit of the patient. So CHACAO is focused on development of the profession, cohesion in the field, work with partners in regard to policy as it relates to advocacy and patient safety.
Great, Danielle.
Oh, thank you so much. As you mentioned, I'm the executive director for PACB, and that's the Patient Advocate Certification Board. We're a nonprofit organization, and our primary focus is on setting standards for patient healthcare advocacy. So while CHACAO works at the professional level for the organizations that serve the space, we work more at the individual level to ensure that those advocates that are out there are practicing in a safe and standard method and are following the appropriate ethical and professional guidelines. We issued a board certified patient advocate credential, and it was established back in 2012 by a group of visionary folks who recognized that there were all these people out there actually performing this role, but in a very non-professional way. There wasn't no such thing as a patient advocate in terms of the professional practice. And so they set out as professionals in other aspects of the adjacent areas, I would say. Some of them were nursing, some of them were academia. There were a variety of different professionals associated, but they formed and developed the organization. And then once they established the original standards, the domains of practice, they started working with a psychometric firm who then was able to help them develop the first exam, and that was launched in 2018. So
Great.
our primary goal is to professionalize the practice of patient and healthcare advocacy and to ensure that it is that the public is represented in a safe and productive manner by ensuring that folks who earn the credential have demonstrated competence in the role of serving and things.
Great. And Fred.
Thank you for having me, Mark. And as you mentioned, I'm Chief Operations Officer with Health for All Foundation. And we like to say Health for All Foundation is one of the biggest foundations you've never heard of because we help over a million patients, giving away over $4.1 billion in assistance. Our vision is to ensure that no patient goes without health care because they can't afford it.
Right.
And so we have made it our mission. I know that vision is like an ambitious one. How can whenever can we get to the point where no patient goes without health care? But in pursuit of that vision, we've made it our mission to focus on the underinsured patients that have insurance, but insurance is not enough. They have to pay high copay or deductibles or premiums in order to have access to medications and treatments. So we've set up over 90 disease funds through which patients can get assistance for copays and deductibles and premiums to be able to get access to their medications. And we in addition to those 90 disease areas, we've expanded to include other areas like travel assistance, and then also, looking into helping with um, uh, mental health situations, right? So not only are we providing assistance for drugs for, say, breast cancer, MS, and all that, we're also looking at helping folks to get treatments or access to treatments for mental health care. So that's what Health for Health World Foundation is about. And we were founded in 2003 and have been in place since then.
Great. Well,
Yeah.
excellent.
Yeah, that's amazing. It's really impressive to hear about all this. Rachel, why don't we turn to you? I know you bring the perspective of being a patient yourself, but also as a consultant in healthcare and now managing director of the coalition. Could you begin by helping us understand a bit more about what healthcare and patient advocacy is and maybe how it's evolved a bit over the past number of years?
Sure, my pleasure. So yeah, as you said, I am a patient like all of us, and I was a patient that used a lot of healthcare for a while. I'm a two-time cancer survivor, adolescent young adult cancer survivor. So I had cancer when I was 15, and again when I was 35, and came into patient advocacy work myself, as a lot of patient advocates, professional patient advocates do, through helping other people because I learned to navigate the system at a young age and developed those skills, and then became a board certified patient advocate. CHICAO, the Coalition of Healthcare Advocacy Organizations, has jointly adopted a code of ethics that for patient and healthcare advocates that uses a specific sort of summary definition because the word means so many different things, and sometimes that nomenclature can be really confusing. So we use this definition to sort of define who we're talking about, but we also know, understand, and recognize and support that there are other different kinds of advocates. But according to the adapted code of ethics, I'm going to read this so that I get it all right. Professional patient and healthcare advocates include, but are not limited to, health and healthcare advocates, patient navigators, health or patient advisors, care managers and case managers, as well as those who work on behalf of communities, consumers, and family caregivers, including in advocacy and legislative and health policy initiatives. So these advocates might work in a variety of settings. They might work independently in medical settings on behalf of disease-specific communities. Um, and the evolution of the healthcare advocates or the patient advocate is kind of long and old. And if you even want to think about it, it's super old because we can think about midwives actually as healthcare and some of the first healthcare advocates, people who help people through birthing, supporting the woman or the birthing person. So getting a little bit closer to home and in more recent history, we can look at sort of this era of the early developments of advocacy as a profession around the 1950s to the 1980s. This is when community health workers started working nationally and internationally, or being recognized as working in the United States as working internationally. They were already doing that. Um, the Patient Representative Department was established in 1967 by the Society for the Healthcare Consumer Advocacy. A Patient's Bill of Rights was adopted by the American Hospital Association in the 70s. In 74, George Annis and George Healy suggested in the Vanderbilt Law Review that every patient needs an advocate, which was pretty important. The first master's program was developed in health advocacy at Sarah Lawrence in 1980. And in 1985, geriatric care managers formed a professional organization, later becoming Aging Life Care and certified care managers who work with aging adults. And then the first patient navigator program, kind of in the 1990s to the 2000s, this era of things developing even further. First patient navigator program was developed by Dr. Harold Freeman at Harlem Hospital. In 1996, the nonprofit Patient Advocate Foundation, which many people know well and has been around for a while, started providing case management services, free navigation and support to patients. And then in 1999, many of us have heard of this big publication called To Err is Human by the Institute of Medicine, where it was surprisingly discovered that up to 100,000 deaths a year were caused by preventable medical errors. And that really highlighted the need for professional patient advocates. Um, so then in this expansion of the professional end of things, or in the 2000s to present, we can look at around 2009, Tricia Torrey started the Alliance of Professional Health Advocates and had the first Advo directory where people could find advocates to work with that they wanted. And in 2010, the Care Partner Project launched, as well as the National Association of Healthcare Advocacy Organization or Association of Healthcare Advocates. Pardon me, so many acronyms. Um, and Paul Farmer, also around this time in the 2000s, was talking about this need for accompaniment and writing about the need for accompaniment. In 2018, Greater National Advocates and the Patient Advocacy or Advocate Certification Board was founded, and those are both members of CHICAO. And Health Advocate X was also a member of CHICAO, was in 2012. And then in 2022, I'm going to stop now. CHICAO CHICAO was formed, and we act as an umbrella for four right now with four member organizations: NAC, GNA, Health Advocate X, and Tech Board.
Yeah,
So a little
great.
history
Yeah, it's a very rich history. Thank you.
there. Yeah.
And Danielle, from your perspective, your organization has been instrumental in turning advocacy into a profession, as you mentioned in your introduction. Could you tell us about some of the milestones that you've been involved in to get us to where we are today?
Uh, well, yes, it's both complicated and simple. We are heavily focused on establishing a standardized curriculum that will help to not only provide but enhance the availability of training programs around the country. One of the things that is while there are training programs out there, they're not particularly standardized, and that's one of the core elements of a professional practice is a standardized body of knowledge. And so, our recent job task analysis that we just finished, it was started actually in 2019. We just published it earlier this year. And the reason it took so long was because the original job analysis, which is the standard bearer project that all certifications or all professional practices use, is a way of establishing what the actual tasks, the knowledge, skills, and abilities are that are required to do any particular job. Since the first group didn't really have practicing, but they had practicing advocates, but there was no profession. So they had to do something more like a crowdsourcing kind of activity to figure out how to assign those first domains of practice. There were 7 domains of practice at that point, and not really broken down into the specific detail that we have now. But the 2019 to 2024 job analysis is extremely detailed. It's available for to review if you want to have some insomnia reading material. It's a great study to read, but it's actually a very it's a wonderful report, and it breaks down the domains of practice, which are now condensed into 5, and it goes into very specific detail about what each domain covers, the tasks that are required to perform each of those in within each of those domains, and then further into the specific knowledge, skills, and abilities that are required to perform each of those tasks. And it's a very detailed report, and we have recently published a new study guide, a new um, um, a variety, all the ancillary materials that go along with the study guide, the key terms, all those kinds of things, because we want to make sure that all of our candidates have this most recent and most and very robust material. And so that then leads into where I started this with the establishment of the core body of knowledge and the curriculum. We're currently working with a curriculum development company, and we're trying to establish this standardized curriculum that we can launch nationwide. Actually, they're a global company, so it's potentially we can even launch more globally. We're also looking at some subspecialty exams whereby folks, particularly in the VA and military, would be able to take the exam, but it would not be assessing them on Medicare or Medicaid, the standard insurance that the average BCPA would take. It would be more specialized to them. And then similar exam for international folks would just take out, and Canadians, for example, would take out the U.S. healthcare system elements, but still be applicable in all the other domains. Because the professionalism, the ethics, the scope of practice, all those, the communication, interpersonal, all of those domains remain relevant regardless of what the payer system happens to be. So those are our key initiatives right
Great.
now. Um, it's a lot of work, but
No
we're making
doubt.
good progress.
And a lot of important work.
Yeah, amazing. Well, Fred, let me turn to you. We're aware that you've obviously been involved with several important organizations in this domain on the front lines, helping patients yourself. And at the same time, we all understand how incredibly complex our system is to navigate. Maybe you could share with us some real world examples from your experience of how advocates help patients.
Absolutely. Happy to. And I can give a few examples here. First of all, I want to start by, my definition of an advocate includes anyone that steps in to help those patients that are, attempting to get access to the programs that we provide, the assistance that we provide. We work in a very highly regulated environment, and so we have to establish certain criteria for folks that we have to help. And in doing so, one of the things that we insist on doing is to make sure that we have this quality of first come first served. So that basically makes it equal, right? And, anyone that comes first, whoever comes first gets the grant. But it also, in trying to provide equality, it also introduces some inequities in the system. What I mean by that is, for instance, we open our funds, mostly at 9 o'clock, 9 a.m. That was what we did before. And it's open to everybody. You can go to the website and enroll or access it through our portal or pick up the phone and call the hotline. So in our mind, it's equal. We open at 9, everybody gets in. But it was through the feedback and heavy reliance on advocates that got us to thinking that actually that is not equitable, because the folks that are living on the West Coast at 9 o'clock to 6 o'clock there. So no, provider office is not open, pharmacies are not open at that time. So in listening to them, to those advocates that were advocating for patients on the West Coast, we, adjusted the time that we open funds from 9 a.m. to 11. I mean, it's not the best, but at least it's better than 6 a.m. on the West Coast. So that's one example of, just hearing from, advocates who are calling on behalf of patients that caused us to take a second look at that. So that's just one example. Another example is we started out with a fund, a CF fund called Cystic Fibrosis Fund, which included, assistance with treatments for the disease itself, and then also vitamins and supplements. So we had all of that under one fund. But we got advocates calling and saying, look, as much as we appreciate this fund for patients, there are some who have Medicaid that don't necessarily need assistance with the treatments. And you have a fund that is providing, or 15,000 at that time was the, the grant cap. But a lot of those folks that were Medicaid only needed about 1,500 just to access vitamins and supplements. So when you create a grant, or you provide a grant to such a patient, you're just basically holding up money that could be used to help those who are actually in need. And it was at the time when we kept asking for more donations, because we actually serve over 40% of the CF population, in the fund that helps them. So that led to us splitting the funds, the CF fund, into the vitamins and supplements fund, and then the CF treatments fund, which allowed those who only need assistance with vitamins and supplements to just enroll in that, get 1,500, and then for those that are needing assistance with the treatments, can get access to that. So with that move, we were in a position now to serve the patient better. So that was all as a result of hearing from the advocates, who are basically the pharmacists, the physicians, social workers, financial navigators that we work with. The other thing they do is they insist on understanding our programs. So we do webinars for them to really go through all the different changes that we have in the programs. They are very good at learning about the program so that they can in turn, help their patients. So I get emails and questions from advocates, working together with them and making sure that we are making, the right changes to our program. And then the last thing is, because of advocates, we ended up changing the website, translating it to Spanish also. That was a suggestion that came from the field. And look, there are a lot of our patients that are Spanish patients. They can't apply when they can't speak English. So we did that. We also introduced a language line to our hotline, which has over 50 languages. So any type of language that you can think of, they can call and have it translated for them to be able to get access to that. All of that is in an effort to make sure that there's equity in folks accessing our programs. So those are just a few examples that I could provide.
Well, no, those are great examples. If I could, though, and Rachel, let me start with you on this next question, which is because the scale of this is a little overwhelming, right? I mean, we all know that we have a complex healthcare system, right? Scott and I have been doing this podcast now for we're in our second year, but our careers have been around all the challenges in patient, access and affordability. And so, and as you mentioned before, like we've all been patients, we have family members, we've all had to do our own advocacy for our families as well. So help us understand, Rachel, the scale of advocacy within the United States, and do you have any sort of numbers on professional advocates versus family or volunteer advocates? And what could you tell us about just again the different aspects of advocacy?
Yeah, I'll kick this off, and I think have Danielle chime in with some numbers and some more information. But I think I can speak to the fact that we have so many advocates and so many different roles because healthcare is fragmented and broken as a system. So, you know, advocates pop up as patient navigators in a healthcare in a, institution because it's necessary in that institution and patients need help. Independent advocates pop up because they've been doing it and helped so many people and have had, complex situations to navigate. Family members and self advocates take over because healthcare is really challenging and people need help. So, I mean, if I were to guess how many people have advocated for other people in the healthcare system, I would almost say it's like, unfortunately, it's not one to one because not everyone has had an advocate's help. But everyone needs an advocate's help.
Right.
So there's so many different people working in so many different settings because of that need. And I think it's just, across the board, if we look at the whole scope, including, Fred's addition of the physicians and everyone who advocates on behalf of a patient at different times. There's so many people play this role at so many different times and so many different times of their lives. So I don't have that number, but I can say, we can talk a little bit more about the professional numbers of people who do this for their job. And I can also say that individuals who work as professional advocates, who have specializations, especially, just might be able to navigate those more critical and complex tasks. And the roles of a family advocate or a self advocate are hopefully very complementary. And working with the team of healthcare folks who are working for that patient is also very complementary. That is the whole drive and hope of a professional advocate, is to get everybody on the same team helping a person navigate a complex situation, or prevent a complex situation in some cases.
Danielle, you want to add something to that?
Yeah, Rachel covered it really well. I mean, the key word there in the $60,000 question is the fact that it is so fragmented and it's very difficult to quantify um, something that exists in so many different places and is delivered in so many different ways. As the certifying body, we certainly recognize folks in all of those categories, and that's one of our core goals, to help bring everybody together under this umbrella of the professionalism of making sure that especially folks that don't have strong support systems, that's really where the role of the advocate can make a significant difference, because the advocate in those situations is there to ensure that they have access to informed, ethical um, information, and that even that they are able to benefit in the same way that somebody who might have a very dedicated family support system wouldn't have. So it helps to standardize care, helps to uphold patient rights, address those systemic issues. But yeah, it's a huge challenge, and I'm sure that all of us would agree that um, advocates are everywhere, and we're trying very hard to figure out how we can kind of come together in a more organized way and agree on what we can agree on, such that we can benefit the patients. And, that's really what we're all about.
How many certified advocates do we have now, Danielle?
Oh, yeah, that is a good number to throw out there. We only do the exam 2 times a year. So we have 2 cohorts a year, and we've currently certified over 1,200. So that's like 1,256
Yeah.
advocates, professional advocates since 2018 inception. And we're about to start our fall exam cycle here in about a few weeks.
Yeah.
And we know from some of the US, like, polls on rising professions and, like, things changing, in healthcare, that patient advocacy as a profession in one way or another is very much on the rise. There are more and more people coming over to advocacy from other roles and, um, new roles.
Yeah, I that makes sense to me, Rachel. I think this notion of sort of concentric circles almost, of like starting with the patient and then family and other caregivers, and then maybe their own professional medical staff who are helping, and then a whole host of folks, and then this core profession, individuals who've chosen to become accredited and do this professionally is a really interesting way to think about it. Danielle, just a follow up
Mhm.
uh, about understanding the impact of all of this.
Right.
What can you share about efforts to measure the impact of advocacy on patient outcomes? And is there anything that your organization in particular does in that domain?
Well, that's really probably more on of the domain of the Chicago group than it is specific to us. But I can say that in the both in the white paper that Chicago published about a year ago, and then in our job task analysis paper, which is similar in terms of the kinds of things it evaluates. There is measurable impact in terms of patient satisfaction. That's probably the highest in terms of patient satisfaction, patient confidence in their ability to make informed decisions, and of course, reduce readmission rates, and definitely in helping folks to personalize their care plan. That is something that um, is more important than we think. That we don't give it credit for folks wanting to have a care plan that matches their personal goals and their uh, just their preferences, their cultural preferences, if nothing else. Looking my notes here to see if I have anything else. And we definitely know that advocacy, as Rachel alluded to this earlier, it's most effective during those really key decision making points. We find that if rare diseases or very complex diagnosis, treatment options, and care transitions, those are obvious, areas where uh, an advocate would make a bigger difference. And then also in the underserved community. And we actually have a scholarship program that's intended specifically to generate more advocates that are either from those those communities or whose advocacy work is specifically aimed at surveying those communities. And so we're really working hard to, to help help folks in those communities challenge those more discriminatory practices.
In our white paper on the impact of patient and healthcare advocates is available on our website, and it has a lot of data around what we've gathered from a pretty good sizable survey response of I think we had an end of about 500 plus of patients, advocates, and healthcare professionals as well who work with advocates, chiming in about how patients support. Um, I think they said that 94% of client patients said that working with an advocate positively impacted their care. 90% of patients who worked with an advocate reported positive experiences, and many people felt more empowered and valued and less vulnerable. 99% said that they would recommend working with an advocate to family and friends. Um, and healthcare professionals also said that, 70% of them said that it enhanced patient understanding and increased more, understanding of medications, set more realistic expectations.
Yeah, very impressive. Thank you.
Mhm.
Yeah, if I could, I just want to turn to, Scott and I, the topic of our podcast is around access and affordability of medicines, right? And I know that healthcare advocacy goes much broader than that. And but if I could just maybe turn to you, Fred, with this question, because you went through some aspects with the CF vertical that you have and others that you do, but could you help us understand, first of all, what are some of the barriers, right, that you're helping to overcome, and then how, you know, like what's in place to provide that support,
Mhm.
not only to get access to the medicine, but also to afford the medicine.
Absolutely. Thank you. I think that the biggest barrier that we're trying to tackle is the financial barrier, right? That you have uh, prescribed medication, you have insurance, and then you go to the pharmacy to pick up your meds, and they tell you that your copay is $5,000, and that's not, it happens. And the
Right.
patient turning around and saying, "I can't afford it," and so they want to come back or they put it on their credit card, and that creates a whole host of issues. So what we have in place is the people, efficient processes, and the technology and innovation that we have in place to ensure that we can give money. So this is what we do. We want to give money away to patients to help them to clear that financial barrier so they can get access to medications that they badly need. And so that's what HealthWell is about. The only criteria that we have is that they have to have some type of health insurance. Remember, our focus is on the underinsured. So have to have some insurance and have to have a diagnosis for which we have a fund set up. I know we have 90 plus disease areas, which is not enough. There is more than that, right? So we continue to try to add to that. But a patient must have the diagnosis and be taking a medication that is covered under the fund. And then the other criteria is that their income has to fall within the 500% FPL range and must be treated in the US. If they meet this criteria, then we can't wait to get money into their hands so they can clear that barrier. And other things, in addition to all of this, we have made it easy for folks to find us. And thanks to the advocates that we work with, we attend some of these conferences in an attempt to make sure people are aware of what we have, right? And so we have a website where they can go to. It takes only about 8 minutes to apply. We have portals that are set up for providers, pharmacies, nurses, social workers, advocates who can actually sign up and manage the patients that they are serving in the portal. So they can see when a patient's grant is due to be, to end, so they can re-enroll them, what money is available, all those things. They can manage that on behalf of the patient. But we didn't stop there. We've also, in an attempt to empower patients themselves, have created a patient app. So the patient can, anybody with a smartphone can download the app and be able to access, grants and be able to manage it on their own. So these are all the things that we have in place. But the main thing that we're doing is we know that it's not only financial barrier that is out there, but at the very least, we want to tackle that particular barrier so that folks can get access to the healthcare that they need.
Great. Scott, do you want to ask the next question?
Well, yeah. Well, first, I'd just like to check with Rachel and Danielle and see if there's anything they'd like to add about this issue of the affordability of medicines in particular.
Sure. I think working with an advocate, as Fred was saying, obviously can help you access these programs and
Yep.
understand that they're, especially during really challenging times when you're just surviving.
Yeah.
Working with an advocate of some kind or a support person can help in that way. Also, in terms of access and barriers, like I said, in the impact study also revealed, when you work with an advocate, not only are you getting help, but you're getting education and
Right.
you're getting access to more education and better questions for your doctor or nurse or pharmacist. So
Yeah.
you can, learn more about the medicine that you take, therefore have better adherence and a better understanding, better integration of that medicine. So that's just other ways that advocates can help.
Yeah. Good. Anything you'd add, Danielle?
Um, Rachel and Fred were both
Yeah.
actually going on, access, knowing about those programs,
Yeah.
Fred said, knowing about them. And the other thing I guess I would expound on a little bit is we have a whole subspecialty area of advocates that do nothing but insurance work because most people do find not only can they not afford the treatment, but they don't understand what coverage they have.
Right.
Sure.
And advocates are particularly those that specialize in that are particularly good and helping them understand their coverage and how to best leverage what they are able
Yeah.
to access.
Yeah.
And then if I may add to that, with the prospect of the IRA, the implementation of IRA 2025, and then the opportunity for patients to enroll in what they call smoothing or a payment plan, that introduces the need for advocates and everybody wants to actually, help educate patients
Yeah.
on whether the smoothing is something that they want to opt in, is if it's going to be beneficial for them. And so that's another way, the insurance can complicate things, and it's important that they have someone working with them to help navigate the complexities of insurance.
Yeah. Yep. Makes sense. And if we look to the future of advocacy, what might we expect for the profession over the next several years? Are there any policy or healthcare reforms that you'd like to see happen to improve the role of the advocates? Will technology play a different kind of role in the future for the advocacy efforts? What are your thoughts on that?
Don't be shy.
Yeah, Danielle, why don't you start? I'm sorry.
Okay. Um,
Policies, technology, other developments.
What's
yeah, policy, that's, we really want to be able to see more formal recognition of advocacy, uh, however that comes to pass. Um, Advocates that work primarily, most of the advocates that we work with currently are private pay, and we recognize that that's just not a feasible option for everybody, especially those folks that work in more of the underserved communities. And so we really want to be able to recognize and understand more business models that help to incorporate a larger scope of advocates that can work, and because the difference between someone who is employed as an advocate, or I won't say the difference, but there is a distinction in that if you have a private advocate working with you, that person's allegiance is strictly to the patient. There is no other allegiance to
Yes.
anybody else, an employer who pays their check or whatever. And we just really want to be able to figure out how to um, I guess what it means is that we continue to work with groups like Fred's group and the various other groups and try to come together in a more cohesive way such that we can leverage the benefits that all of us have in a more uniform uh, and effective manner. And that's a tall order that I couldn't begin to tell you how that's going to happen. Uh, Certainly, technology will continue to influence medicine probably much more than it will the role of advocacy, because the key element there is the human element. It's the one piece that sort of is consistent across
Yeah.
all those various pathways.
Yeah. Thanks. Fred, I can imagine technology must be having an increasing role in your operations. Is that right?
Absolutely. We're looking at what we can do with AI, how can that help us when we're experiencing those high volumes of activity. So, we want to, depend on that to help. But from my standpoint too, I think I mentioned earlier on that I have noticed that the pharmacists and doctors and nurses are doubling as, advocates. I would like to see, investment in actually, providing advocates for every institution or doctor office or pharmacy, folks that are employed specifically for that, so they can take away that burden off of, the doctor. Let the doctor do what doctors do, and let advocates step in and do the rest of it. I think that will really help, clear more of the barriers that the patients face.
Well, that's great. And Rachel, anything you want to add before we jump to the next question?
Just that I think that that's happening. I think there's more degree programs for health advocates of various kinds, navigators. Institutions are recognizing why that they need someone focused on helping people navigate the system in their care. The independent profession is continuing to grow. People are going from those degree programs into advocacy just as their first job now. That's what they're doing out of school or out of high school. And then there's others who are just still moving from the burnout of the healthcare system into helping patient clients more directly through independent advocacy. So all of those things are happening, I think, at once.
Well, that's great. Another thing that could be happening is I'm reading Kamala Harris's book, "In the Truths We Hold," and she calls for. She talks about the time that she was caring for her mother when she had cancer, and she actually calls for the importance of having advocates, uh, literally assigned to all patients. Like patients,
Mm.
all patients should have access to an advocate. So maybe that's a part of the future uh, of the advocacy community. So that would be exciting as well. Um, but if you are patients, right? If you are, again, I went through this with my mom, others, and my parents, my father as well when he passed away. Where do patients turn to find an advocate? Like, where are the different um, places that they could, besides attending the Healthcare Advocate Summit, which we're a proud media partner of. Um, but where can patients turn? And what advice would you have for patients as they sort of struggle with the challenges of our healthcare system?
I'm happy to kick that off. As far as places to find advocates and community health workers, independent advocates of various sorts. So there's the free nonprofit directory of Greater National Advocates. It also has educational videos to learn about what advocates do and independent advocates do. Um, Really great search tool. There's directories on Health Advocate X, NAC, National Association of Healthcare Advocates, Umbra, Solace, is another place to find advocates and community health workers. Um, and um, yeah, and you can learn more about patient advocates through those sources, and as well as like reading the white paper and checking out some of the social media from those organizations. You can learn more about what a health advocate does so that you don't have to find them or learn about them when you're in crisis. So I think, and I can roll into my advice for patients if that's okay, and then we can go from there.
Absolutely.
Okay, great.
Okay.
Um, so that was, one thing. Proactive engagement with advocacy services, learning about foundations like Health Well and all of those things for yourself and for your family and for your friends. And um, it's really, really harder to do when you're in crisis or someone is very sick. So I consider it a part of preventative care. Um, and I think that when we educate ourselves and each other about the healthcare system, we become a greater contingent of people who can change the way the system works. So, as a self advocacy expert and education consultant, I work with people, medical professionals, and patient groups to really encourage people to become confident in, at whatever capacity, at whatever ability and level of interest, to learn a little bit about their body and the healthcare system. And that just builds on itself and builds confidence. But the other people that need to learn about self advocacy and advocates are healthcare professionals and clinicians so that they can learn to receive advocates and self advocating patients, and know that that doesn't necessarily look a particular kind of way. We've talked about how advocates work in so many different settings and with so many different people and in different manners. And so when an advocate enters a room, for example, with a patient, a clinician might have some pushback because they're
Right.
concerned that they're being questioned. And I think the best thing, and when a patient speaks up alone in a room and says, I read this research paper about this medicine, and I wonder if we can try that, I think that it's the clinician's role to really receive and then engage and get it part of the team at that point, to really, encourage that curiosity and that skill building, because that really brings a person out of their shell and makes them want to be interested in navigating the system, or at least doing it when they have to and not feeling really scared.
Yeah.
That's my advice.
Yeah. Great advice. Um, Okay, so we always wind up our interviews here by asking our guests the same final question. What's your prescription for better access? We're thinking, obviously, from our perspective, primarily about access to medicines, but we know you also have a broader lens as well. And so we'll invite your comments. If you had the magic wand for a day, what's the one thing that you would like to do most to improve patient access? And Danielle, why don't we start with you?
Well, that's a tough one for us. I would say though, probably our main focus and responsibility in that area would be to make sure that patients understand what the role and responsibility of an advocate is and is not. That advocates support and empower, but they don't make medical decisions. They don't give advice.
Hmm.
That they understand what the ethical responsibilities associated with an advocate are. And as with all professional practices, we want to believe that all advocates are 100% focusing on the role of the advocate as it is defined in the standards. But we know that doesn't always happen. And so we feel it's really important that we help to educate the public about what the ethical responsibilities of the advocate are and to hold them accountable to that.
Yeah.
So that's, I guess, even though that's not really access to medicine, but still access to an advocate that can help them access.
Yeah, absolutely. All right, Fred, we're passing the baton to you, the magic wand.
Yeah,
What's your prescription for better access?
I think we've focused on the financial barrier, so that's where I would stick with. And I think the prescription will be that the PBM fight with the farmer and farmer fighting PBM. Maybe let's resolve that because I think that's there's an African saying that when two elephants fight, it's the grass that suffers.
Right.
This fight is causing the pain to patients, and so let's resolve that already and remove the financial barriers that is causing.
Yeah.
Excellent.
That's a good one, Rachel.
I think I said it in the last thing, awareness of advocates and
Yeah.
the opportunity to just self-empower in those spaces when it feels hard. Ask the questions, ask for an advocate, ask for
Hey,
We
Caleb.
lost, yeah, we lost you there for a
can you
second.
hear me?
I'd
Yeah.
say I'd say do that one
Yeah.
until it's over.
Punchline.
I know. We're gonna.
You were
Scott,
there.
you want to ask Rachel
All
one more
right.
time?
Yeah. That's a good one, Fred. Rachel.
Yeah, I think I said it already, but I would say encourage the awareness of advocates and for patients to really feel empowered in healthcare settings when they can, and to ask the hard questions and to know that that's their space and their time. Ask for an advocate if you don't understand, because it's our healthcare, it's our body, and these are our choices. So, just to continue to push through those hard moments as we can and ask for help when we can.
Yeah. Good advice. Great. Well, Mark,
Great advice.
let's wrap things up.
Do you want me
You
to go
wanna-
first?
Yeah, I'd love to. This has really been a fun discussion for me. I liked at the outset there Fred's comment about the largest foundation you've never heard of. I kind
Right.
of feel like this whole advocacy movement is sort of fits that model. It's a really remarkable foundational movement and capability. It's a large, diverse group of people, obviously, and of organizations and of activities. If you think about all the ground we covered here today, rich history, very impressive professional development over time, a very positive evolution from sort of a grassroots efforts early on to what's now a robust and very professional ecosystem today. It made me reflect about us, Mark, and our role as advocates, actually,
Right.
including here on the podcast. We often tell ourselves and tell our guests that, we're here to educate and advocate and inspire, a path to a better system and all these things. And also maybe reflect on the teams that we've worked with, in the hubs and in the manufacturers and all those. And, all those case managers and field reimbursement managers and intake specialists and all that, they're all advocates as well. And so my mind shift, we really went from a them to us, kind
Right.
of thinking about all this. And lastly, I'll just say, as the complexity of healthcare continues to grow, as the complexity of accessing medicines continues to grow, our need for advocates grow as well. And it's clear to me from this podcast and all the other ones we've had on our ecosystem that the advocacy is a growth industry for sure.
Right.
So,
Right. No, I think I totally agree. I think, from my perspective, again, I've been doing this, and Fred and I have had a chance to intersect our careers over times, whether it was, the Cystic Fibrosis Foundation, whether it was Theracom, whether CareMedics. He hasn't been with CareMedics, but as you know, we do
yeah,
provide these services, and I've always looked at the advocates as the heroes, the unsung heroes of our industry, right? They're the ones who are dealing with the families, and I've been on the phones. I've listened to the calls. I know the challenges and the highs and the lows. And when you have the opportunity to tell a family member that, you know, that just because they have a prescription doesn't mean they get treatment, right? And what a blow that is, right? Because we're in a society where you think that you get an RX and there's something that could treat my child or my parent or myself, but that's not the time to celebrate. The time to celebrate is actually, you know, when you can actually get access to it and afford it. And the heroes, these advocates, are the ones that get us through that time period and overcome these barriers. So for me, that's one part of it. I think you're right. I love the fact that there's so much work going into the profession, creating this as a
yeah,
profession, right? Because I'm gonna I'm gonna equate this to another part of my father's work, which was as a social worker and civil rights, but he also was at one point in his career involved in aging, and the home health aides were used to be family members, right? Like everybody was family members, and that industry created literally standards and professionalism and has grown that up. And I think we're going to wake up 10 years from now, and patient advocacy is going to be a professional, not only a profession, but something that's recognized and paid for by Medicare and Medicaid and others for the work that's being done, not just tucked into the cost of the overhead of a doctor or an institution or anything else. Like it should be, it should be recognized for what it does, which is this incredible role that they play to create better outcomes for patients. So for me, those are just a couple of things that I took away from this, and so, anyways, those are some of the key things.
yeah, terrific. Well, I'm glad we have them.
Great. Well, with that, Rachel, thank you for joining us. Danielle, thank you for joining us. Fred, great to see you, and thank you for joining us. And with that, Scott, we get to wrap up episode 22 and another episode of Prescription for Better Access. Thank you, everybody, for tuning in. We will have access to not only to Rachel, Danielle, and Fred in our show notes, but we'll have access to a lot of the organizations that were mentioned as well. So people could just click on that and find an advocate and get access. So with
Terrific.
that, thank you, everybody.
Thank you all.